about dermal fillers, but not just dermal fillers used for the typical places like the lips and like the cheeks, which we all know, about some of the unusual places, the less common places to use these fillers. These fillers are incredible, and if done well, you shouldn't be able to tell where they've been done. If done properly, other areas should peak. If we inject certain areas of the face, we hope people get compliments on other areas of the face, that they look more rested, they look more youthful, they just look great. But there are many different areas that people aren't knowledgeable that we can use, and we hope to shed some light. If you like our video, please give us a thumbs up, and we'd love you to subscribe to our channel so you can stay up to date on cutting edge cosmetic medicine. Thanks.
Oh, first, from Sarah from West New York, she says, I've been seeing doctors injecting filler in the forehead, and I'm curious, why would you choose filler over Botox for the forehead?
Great question, Sarah. So customarily, patients receive Botox or Dysport or Juvo, the new kid on the block, for the lines on the forehead. But essentially what we're doing is slowing down some of those muscles that are responsible for elevating our brow and making us look refreshed. So at some point, too much Botox is a bad thing. And if people want to see more line reduction, what we tend to do is fill the forehead to give the forehead support, not to change the shape of it, but just to give the skin support. And in so doing, we can use less Botox, and that's an advantage. The second thing, as the lids get heavier, we tend to reflexively, in order to try to compensate for that, we tend to use our muscles more to elevate the brow. That causes lines and wrinkles. And a novice typically will look at those lines and wrinkles and put Botox, and that causes the most common complication of Botox or Dysport or Juvo again, which is depression of the brow.
Gina from New York City asked, I have these deep lines on my chest that reach all the way up to my neck. Is there any way to get rid of them? I've had a laser treatment to try to remove some of the sun damage, but it didn't help.
Great question. So in terms of chest rejuvenation, different things happen during the aging process and from positional changes, i.e. sleeping. So women will develop vertical lines, deep creases on the chest. And the use of lasers is more for the quality of the skin, the fine lines, the texture, the wrinkles. But for those deep creases, there's where we use dermal fillers to give that skin support. So these dermal fillers can create support in the skin. They can take some of those deep lines, and then we use resurfacing lasers to make the overall skin texture better. Again, one common cause of those deep lines are sleeping on the side. Okay, so if someone's forming deep lines and they want to know, well, what created those deep lines, bring our arm across and see if you can reproduce those deep lines. If you do, most of the time they're sleep related. Great question.
Next comes from Teresa from Whitehouse Station, and she asks, I've seen you injecting filler into a woman's earlobes on Instagram. What does that do?
So earlobe rejuvenation is kind of a cool thing that most people don't know much about. So inside the earlobe is fat, the same fat that we have in our cheeks, under our chin, and even in the forehead. So that fat holds our skin up, makes our skin look youthful. In the earlobe, when we lose fat, the earrings tend to droop, and we form deep, deep creases in the earlobe. So re-inflating that earlobe with dermal fillers is a safe, easy, and extremely satisfying treatment. Literally, in a matter of just minutes, that earlobe looks youthful again, and earrings look much better.
Tina from Basking Ridge wants to know, I'm turning 50 this year, and I've noticed my knees look terrible. I've got a ton of wrinkles and loose skin, and I don't want to have surgery. What can I do?
Happy birthday, Tina, first of all. So what can we do for knees? Knees have been one of those issues that good treatments it's escaped us. So as we age, gravity takes its toll. Number two, today we're trying harder and harder to bring our body fat down, and as we do that, there's less support for that skin. And the third most important factor is sun exposure. through use of shorts and skirts, there's sun exposure that tends to end mid-thigh. So the elasticity of that skin in the knee area is reduced. So when we take that elasticity, reduce it, we reduce some of that fat in the area, and we add gravity to the picture, we start to see aging in the area in the knees and above. Well, we didn't really have great treatments for that in the past, and now we're actually using stimulatory dermal fillers, i.e. fillers that can stimulate collagen. So we're not making the knees bigger, we're not making the thighs bigger, we're making that skin stronger. The most well-known for this area today is called radius. So through a series of treatments, we can make that skin look much more youthful, and you want to start as early as possible. And the last thing is, the same kind of topical agents we use on the skin for the face or neck, you want to use on the legs. So retinoids and growth factors and antioxidants and peptides, the things we know work for the face, they also work on the knees. So we want people to integrate them into daily regimen as early as possible, because it's a lot easier to prevent the damage in the first place than it is to fix it once you have it. And naturally, sunblock.
Next, Tom from LBI said, over the past couple of years, I've noticed a lot of loose skin along my jawline, and now it just sits there by the sides of my mouth. I really don't want to do anything surgical, but I'm pretty sure I'm past the point of what any skincare can help. Any thoughts on what exactly works?
So we actually took a look at that photo, and what that is, Tom, is actually fat in the jowl area that has redistributed, meaning it used to be volume or fat that existed in the back part of the jaw, and because of gravity, that fat now redistributed to the front. So if someone wanted to do surgery, sure, you can tighten the muscle, remove some of the extra skin, but actually the image shows a lot of fat here, and one can actually dissolve that fat in the jowl with an injectable called Kybella. The FDA clearance for Kybella was initially for the area underneath the chin. Well, we now use it for the jowls, and in very small amounts it can have a dramatic effect on the appearance of the jawline. So we dissolve the fat in the jowl, it reduces over about 2 to 3 months, and then if need be, we add some dermal filler into the corners of the jawline to help pull that skin back. So non-surgical rejuvenation of the jawline is extremely common today and extremely satisfying. And the first thing we have to determine is what you're seeing over here, extra skin or is it extra fat? With Tom, it was actually extra fat.
Okay, next, Helena from Jersey City asked, I've noticed I looked a little gaunt in my face as I've aged. I'm not sure what's causing that. Any ideas on how to fix?
Again, when you look at photos, we like to see symmetry between the upper face and the mid face and the lower face. And very often, as we age, we lose volume in our temples. And as we do, it gives the appearance of the eyes being closer together. So oftentimes being gaunt is volume loss right here. An injection of filler into those temples can have dramatic improvements on how well we look, how youthful we look, how healthy we look. And you could take someone with the most hollow temples, reinflate them, and someone looking at that person just compliments them. They just know they look better, but they never can put their finger on what's actually been done. So temple filler, great area to inject. So it's not always about the cheek. Sometimes people come in with hollow temples and they'll see a novice injector and all of a sudden their cheeks are getting injected where the problem is really in the temple. And if you have hollowing in the temple and you inject the cheek and make the cheek fuller, it actually makes the problem worse. It makes the temples look even hollower and it makes that person look even more gaunt. So this again is about symmetry. It's about balance between parts of the face. And we want people to look, again, more youthful, more rested, but not done.
Meredith from Piscataway said, I've been told by a plastic surgeon that I need a chin implant to fix my recessed chin, but I definitely don't want to have surgery. I've seen people get filler in their chin on YouTube. How does that work?
So injection of the chin with filler is becoming more and more popular today. And even if someone is contemplating surgery, where most people aren't, a injection of a filler can give you an idea of what that implant is going to look like. So that filler can be used to lower the chin, to increase the projection of the chin, the width of the chin, but the chin is a very important part of the face. It's something that when we improve it, very often people get compliments on their cheeks or their lips. They don't realize that something has changed here. So it is something that we look at and we talk about the symmetry, again, between different parts of the face. There's a rule of thirds where approximately 1/3 of the height should be here, 1/3 and 1/3. So sometimes when the chin is short, it makes our cheeks look large, and sometimes when the chin is large, it makes our cheeks look small. So we're changing the width, the projection, different shapes of the chin to make it all work together. So our face looks seamless. And when you look at someone, you look at their eyes. That's really where you want to focus attention. If there's some issue in a different part of the face, unfortunately that eye is drawn to those other areas. We want the eyes to track by looking at this triangle right in the middle of that face with attention to cheeks and eyes.
Okay, our last question is from Rachel from Cherry Hill, and she said, my hands have become really veiny and unattractive with age. Anything I can do about that?
So hand rejuvenation has come a long way. We used to have only one agent that we used, and now we have several that we use in the hands. Historically, we used fat, and unfortunately, sometimes it worked out well and the fat lasted, and sometimes we put fat in the hands and the longevity was poor. So dermal fillers are the mainstay of volume replacement, and my favorite now is called Restylane Lift. It's made out of hyaluronic acid, which is a naturally building block of our skin, and it's something can make the hands look much more youthful. But it's not about veins. Visible veins in the hands are actually normal. That is nothing that we try to hide. The tendons, however, the straight, rigid lines that you see that lift, those are things that make a hand look much more less youthful, older, I should say. And injection of dermal filler can hide those tendons, but the veins themselves are normal. We don't try to hide those. So dermal filler in the hands, great treatment, makes people happy. They feel good about their faces now, and they say, you know what? My hands are giving it away. What can I do? Restylane Lift. Thank you so much. These questions are awesome. People are more and more engaged in this field, and they're reading and they're learning. So it gives me chills when people come with all these questions, and the questions are getting better and better. They're getting trickier and trickier, and hopefully I'm keeping up. So thank you so much for your attention, and we hope to see you next week. All right, so we got to change this up. So that makes sense. First of all, doing this flat without show pictures.
Hang on.
They're great.